My name is Professor Bonga Chiliza. I am head of Department of Psychiatry at the University of KwaZulu-Natal, and I'm also president of the South African Society of Psychiatrists. There is now growing evidence that alongside the COVID-19 pandemic, there is also an unseen accompanying psychological pandemic that evolves with the development of the pandemic. As you have noticed, COVID-19 has caused a parallel epidemic of fear, anxiety, and depression. The difficulty is that the social distancing or physical distancing strategies that we are using to mitigate COVID-19, in fact, actually increase the risks of isolation and loneliness, and therefore increases the risks of developing mental illnesses at this particular time. We know that pandemics are stressful because of long quarantine periods, because people are fearful of infecting each other. There's often a lot of frustration, a lot of boredom, and of course, we know that there's unprecedented amount of financial loss. All of these things, I think, are really important risk factors for developing mental illnesses during the time of the pandemic. We believe that there are three areas or three types of conditions that are particularly important when discussing mental health issues and COVID-19. The first one is around anxiety and depression. The fear and worry of people's lives being threatened by this virus has definitely increased the individuals developing anxiety and depression. And we've also seen that people that already have anxiety and depression have often a worsening or deterioration of their condition. Secondly, there's been some work which has shown that people who are otherwise clinically stable developing features that are very similar to post-traumatic stress disorder. And these are features that usually happen when someone is threatened with a severe stressor or trauma. And the third important area that one must consider are patients with serious mental illnesses and those with cognitive deficits, like dementia. And we find that these patients with these illnesses have definitely much harder to institute the kinds of responses that we like during the COVID-19. So, for example, when you're talking about physical distancing in people that have bipolar disorder, for example, that are disinhibited, you'll find that they will struggle to actually go ahead and do these or change their ways when they're particularly when they are ill to be able to physically distance themselves during this pandemic. In general, mental health care users have a lot more comorbidities than the general population. And the reason we think this is because they have lifestyles that put them at higher risk. Or, for example, they've got higher rates of smoking, they are likely to lead a much more sedentary lifestyle, and they often struggle with medication side effects, which preclude them from doing exercises. And therefore, we think that they are more likely to have multiple medical conditions, which will then make them at a higher risk for mortality following infection with COVID-19. And therefore, this is an important group for us to really to look after at this time during the pandemic. Please inform your patients that they should not and must not stop taking their medication. This abrupt stopping of taking medication definitely increases the chances of relapse. If the patient is in any doubt and is worried about the medication, they can and must contact their treating psychiatrist who has seen the patient before. Medication side effects and adverse events obviously may still occur during this time, but we encourage our patients to please seek a doctor's advice if they're experiencing side effects and not to stop the medications themselves. However, the usual principles of changing psychotropic medications still apply. So please do not stop any chronic medication abruptly. Cross-titrate medications according to the side effects of the medication. So, for example, if the medication you are stopping is a sedating one and the new medication is less sedating, please cross titrate very slowly so that the patient can accept the new medication and not feel that the new medication is not good enough for them or is causing them increased anxiety. The one issue that one should be worried about at this time is potential drug-drug interactions. For example, there's been a lot been mentioned yet unproven, but been mentioned about chloroquine prophylaxis in this time, or even hydrochloroquine as a treatment for COVID-19. We just wanted to alert healthcare professionals to please be aware that many psychiatric medications do increase QTC interval, and therefore potentially this could be a drug-drug interaction with chloroquine. All new patients who present with new onsets of symptoms of serious mental illness really require a full medical evaluation. A full medical evaluation includes a thorough history taking, a physical examination, and investigations. We believe that there is no shortcut to doing a thorough medical evaluation for new patients. However, of course, we do need to take precautions during this epidemic, and all the usual precautions when you're seeing a patient do apply here. The Health Professions Council of South Africa has now allowed us to perform telemedicine or telepsychiatry to all patients who are known to us who have been under our care in the past. They've also recently agreed that people who require crisis management or crisis counseling, who are not yet known to you as a healthcare provider, can also be assisted via telemedicine to deal with that particular crisis. The guidelines have suggested that the gold standard to doing remote consultations is via video consultations. There are many platforms that you can do this on that are relatively or genuinely secure. One can, of course, consult with the medical protection societies to work out which platforms they would be able to support. And also, a number of medical schemes have now made available their electronics consultation services as platforms for telemedicine. We still need to, of course, to make notes and record the sessions like we do in other consultations. Healthcare professionals are not super beings. It is very clear now in this crisis that indeed all of our healthcare professionals are actually human beings with emotions, and the humaneness has really been evident in on many social media posts at the moment by doctors and nurses across the world crying out saying that they are really feeling they're overwhelmed by this. They feel particularly helpless at times. So we believe that it is very important for us to support the physical and mental well-being of our healthcare professionals. So where possible, they must seek help if they are feeling overwhelmed or feeling particularly stressed, and healthcare professionals must seek help from psychiatrists or psychologists, who many of them are available via telemedicine consultations. So the Society of Psychiatrists in South Africa, the South African Medical Association, the Anesthetists and the Critical Care Society, as well as SAISA, which is Psychological Society of South Africa, have come together to organize regional hubs that are going to support our healthcare professionals. We have set up the first hub in Johannesburg, which is already running with volunteer psychiatrists and psychologists who are willing to do crisis management and then referral to the appropriate services following that initial crisis management. We are now setting up other hubs in Cape Town, in Durban, and in Pretoria. We believe that COVID-19 has created unprecedented health, social, and economic challenges. We have also now seen a parallel psychological pandemic developing alongside the COVID-19 pandemic. people with mental illnesses are at higher risk of developing the pandemic, of getting infected by the COVID-19 virus, and also of having their own mental illnesses either deteriorate or relapse. We also believe that healthcare workers are particularly vulnerable at this time, the ones that are working in the front lines, and therefore they really need to take extra care of their own mental health. They need to reach out to psychiatrists and psychologists if they're feeling overwhelmed or if they are feeling that they need extra psychological care at this time.